Hi everybody. I'm here to share with you some really exciting news today. The Secretary of State for Health, Matthew Hancock, has announced that Humber has won the competition to be one of the first waves of NHS trusts in England to receive funding to go paperless prescribing or move into electronic prescribing. This is a fantastic piece of news, and it demonstrates that we are now as an organisation ready to take the next steps in terms of improving the quality of care that we offer to our patients, as well as making life easier for staff as well. So I've got with me today Liat Chong, who's the Chief Pharmacist here at Humber. So Liat, we're going to be investing about £300,000 in electronic prescribing following winning this national bid. Can you tell me of any potential benefits in terms of electronic prescribing?
Yeah, it will first of all improve patient safety.
Okay, tell me a bit more about that.
Because there will be no need to transcribe prescription from one chart to another, so there will be hopefully less transcribing error. Also, any drug-drug interaction can be picked up automatically by the system, so there will be less human error in the system. Staff can also spend less time in the management of prescription because all the electronic prescribing will be transmitted directly over to the dispensary.
So that they'll spend less time running around. So you've mentioned two really key points there. So it's safer for patients because there's less chance of any prescribing errors.
Correct.
And it'll also be easier for us in terms of reducing the risk of drug interactions, which is a big cause of patient harm.
Yeah.
So from a patient perspective, this is great news. From a staff perspective, can you sort of develop a little bit more? Is there any benefits for staff?
Yeah, for example, I have a very small team of clinical pharmacists, so some element of clinical pharmacy can be delivered remotely now, supported by the electronic prescribing system.
So we're a trust which covers an area the size of Belgium with perhaps 70 or 80 clinical teams spread out all over the place. So are you saying now that as a result of that our pharmacists will have to do less driving around and they'll be able to work remotely from trust headquarters or another location to keep an eye on the prescribing that's going on at a ward level? So there's big wins there. So that's a win there for the staff in terms of they have to do less commuting, less travel. Are there any benefits then for the trust?
Yeah, in terms of for the trust, we can manage the prescribing data more effectively because now all the prescriptions are available electronically. Okay. So that will enable us to keep a closer eye on what type of prescription being prescribed and where we need to put our more focus on.
So we'll be able to keep an eye on the costs of prescribing, but also on the efficiency and the effectiveness of that we're prescribing. Any other benefits for the trust?
I think being the trust that have won this particular piece of contract or funding, I think you will raise the profile for our trust and you will hopefully help us with our recruitment.
I think you're right there, because I think what it does demonstrate is that Humber over the last 2 years has made significant strides, and being first wave in a national programme demonstrates, I think, that NHS England see us as a trust that can deliver. So that's a really positive reflection on the hard work done by your team, but also our staff more generally. So that's just a quick update. That's a pharmacy perspective on the exciting piece of this bid. I'll doing a couple of other vlogs around this where I'll be talking to Lee Rickles, who's our head of IT, about how we're going to implement the electronic prescribing over the next couple of months or so. So thank you for joining us, and we hope you found this helpful.